Hi, how are you doing? I'm going to gel in my hand. Good. My name is Victoria. I am a nurse practitioner student for South University, and I will be conducting your head-to-toe assessment today. Can you please tell me your name and date of birth?
My name is Andrew Lee, and my date of birth is June 16, 1983.
All right, perfect. Can you tell me what year we're in right now?
We're in 2021.
All right, and who is the president?
Joe Biden.
All right, perfect. Thank you so much, Andrew. So as of now, patient seems alert and oriented times 4. He is dressed well, hair is groomed, skin is intact, answers questions appropriately, facial looks symmetrical, and no apparent inappropriate facial effect as well. So thank you, Andrew. All right, and can you tell me, do you have any past medical history?
No.
No. Any surgical history?
No.
No. Any allergies?
No.
Any medications that you take currently that are prescribed over the counter, or any herbs?
No.
No?
I just take multivitamins.
So multivitamins, what multivitamins do you take?
I take Mega Man.
Mega Man, all right. How many times do you take those?
Once a day.
Once a day, Mega Man once a day. All right, perfect. Okay, and to save time for this video, Andrew's blood pressure was 120/80, heart rate was 74, respirations was 16, oxygen was 100. His weight is, he's 160 pounds, he is 5'6", and his BMI is 25. Okay, thank you, Andrew. Right now, I'm assessing your skin. May I touch your skin, please? All right,
Yeah.
I'm touching your forehead. Good, his skin is warm, dry, and intact. His skin is appropriate for ethnicity. And Andrew does not seem to be in any apparent distress. Okay, Andrew. Right now, I'm going to start the head-to-toe assessment. Basically, what I'm going to do is palpate your head on down to your toes, and then I'll let you know when to stand and to lay down, okay? Right now, I'm going to start by palpating your head. Okay, I'm noting that Andrew's head is symmetrical. Any tenderness noted, Andrew? No nodules felt, no lesions. Hair is evenly distributed throughout the hairline. Okay, Andrew, now I'm going to go down and palpate your temporal pulses. All right, perfect. 2+, non-threading and bilateral on each side. Now, Andrew, I'm going to go down to your masseter muscles. Can you clench your teeth for me? Good. No pain or tenderness there?
No.
Good. No TMJ noted. No tenderness is there as well. Okay, Andrew, right now I want you to raise your eyebrows real big. All right. Puff your cheeks out. Smile real big. All right. Andrew's face seems symmetrical. No deviation noted. No paralysis noted as well. Okay, Andrew, I'm going to touch up on your forehead, and I want you to close your eyes and don't let me open them. Don't let me open them. Good job, Andrew. All right, next we're gonna sense for sensation in your face. Okay, on each side of your face, I want you to let me know if something is sharp or dull. Okay, we're gonna start. I want you to close your eyes. Tell me is this sharp or dull?
Dull. Well, it's a little sharp.
Sharp, okay.
Dull. 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 Oh, it's a little sharp. Dull. Dull.
All right, thank you, Andrew. As you can tell, Andrew was able to distinguish sharp and dull on each side. I know that end could be a little hard, but you did it very well. Thank you so much, Andrew. Next, we're going to move on to your vision, okay? So I want you to actually look at this Snellen chart right here, and it's already measured at the appropriate height. Can you read height? Can you read the smallest letter on that line for me, please? Actually, can you close your right eye and then read that line?
It's LTFPH.
All right, perfect. Can you close your left eye?
LTFPH.
Okay, good. Thank you so much, Andrew, for that. All right, and next we're going to test for your peripheral acuity. So basically, I want you to cover your right eye, and I'm going to cover my right eye. And you let me know when you see my fingers wiggling coming into sight, okay? All right, let me know when you see my fingers.
I see them.
Good. See my fingers?
Yep, see them.
Good. See my fingers? Perfect. I'm going to do it again. All right. See my fingers?
Yep.
Good. See my fingers? Perfect. See my fingers?
I see them. Yep.
All right, perfect. Okay, Andrew, I'm going to touch your face. Can you look up for me? All right, no conjunctivitis notice. Sclera is nice and white. No redness. No drainage noted. And look at me, Andrew. Pupils is nice and size 3. Okay, perfect. All right, Andrew, I'm going to shine this light in your eye, and I'm going to tell how reactive your pupils are, okay? So I want you to look at my nose. Okay. Good. Perfect. Pupils is size 2. It is bricks and reactive to light and accommodation. Perfect. Nice and round. Good. All right, Andrew, now we're going to test for ocular motor skills with your eyes. So I want you to look at this pen. Do not move your head, just your eyes, okay? Good. Good, perfect. Andrew, ocular motor sensations are intact. It's all intact, so good, perfect. Thank you for that, Andrew. All right, next what we're going to do is, all right, we assess your eyes. That's intact. All right, now we're going to assess your, I'm so sorry. So we did your eyes, visual acuity. Oh, sorry. There you go. Now we're gonna test with the optometrist machine. We're gonna test your red reflex. Okay. I apologize for that. Here we go. Basically, we're gonna look for the redness in your eye. Well, we want it to be red. That is a uniform color that we're looking for. Okay. First, we're gonna shine in one eye, then the other, then in both. So look at me. Good, now both eyes. All right, pupils are nice and red and uniform. That's the color that we want. Perfect. Thank you so much. Okay, next, Andrew, we're gonna move down to your hearing test, okay? So far, we're gonna look at your ears. I'm gonna touch your ears right now. They seem symmetrical to your head. I don't feel any masses, or do you have any tenderness there? Any nodules there? No, any drainage? Okay, good. Good job. I'm gonna look inside your ears, Andrew. Okay. Look inside your ears. Good. Next one. Good. All right. Andrew's eardrum is pearly gray and silver. That's the color that we want. No drainage or redness inside the ears, which is good. I didn't see any lesions or anything, which is awesome. Okay, now, Andrew, now we're going to test for your hearing. I want you to stand up for me. Thank you. I'm going to go behind you. We're going to do the hearing test. Okay, this is called the whisper test. So what I'm going to do is we're going to test for your left hearing by me touching your right ear, and I'm going to whisper 3 words to you, okay?
3, 2, 1.
Good, perfect. And I'm going to test for your right ear and repeat what I say.
5, 4, 3.
All right, good, perfect. Okay, stay right there, Andrew. Now we're going to do something called the Weber test. So I'm going to bang this little tuning fork right here. I'm going to bang it. I'm going to put it on top of your head, and you tell me if you hear the sound bilaterally, okay?
Yeah.
Do you hear bilaterally? Okay, perfect. Andrew was able to hear both sounds bilaterally in both ears. Awesome. Okay, now we're going to do something called the rhyme test. I'm going to bang it again, and I'm going to put it in the back of your ear on the bone, and you let me know when you don't hear the sound anymore, and then I'm going to put it on the side of your ear, and you tell me when you don't hear the sound anymore. Okay.
All right, I don't hear you anymore. I don't hear you anymore.
Again.
I don't hear you anymore. I don't hear you anymore.
All right, perfect. You can sit down, Andrew. As you can see, air conduction was longer than the bone conduction. That's what we want. We want the air conduction longer than the bone conduction. Okay. All right, Andrew, thank you for that. Next thing we're going to do, we're going to assess your, all right, we did the ears, we're going to assess your nose. All right, so your nose appears symmetrical to your face. I don't see any bruising, swelling, redness, or drainage from your nose, okay? All right, I'm going to look inside your nose now. Good, no polyps noted, no redness noted, no deviated septum, and redness or swelling or anything. So that's good, perfect. And now, Andrew, I'm going to palpate your sinuses. I'm going to palpate the front of your sinus down to your maxillary. You let me know if you feel any tenderness, okay? Do you suffer from any sinus problems?
No.
No? Okay. Any pain?
No.
No? Okay, good. All right, good, Andrew. All right. So next we're going to look inside your mouth and throat. Okay, so let me take here. All right, your lips seem nice and pink and it's not chapped. I don't see any lesions or redness or anything. Can you, actually, we wear gloves for this part since I'm gonna look inside your mouth. Okay. All right, Andrew. Say ah, stick your tongue out. Ah. All right, good. Your oral mucosa is nice and pink and moist. That's what we want. Your gums are nice and pink. No bleeding noted. No lesion noted. No swelling or redness. I also noted your tonsils in the back. No redness there. No swelling there. And also your uvula is in the midline where it's supposed to be. All right, perfect, Andrew. So that is good. All right, I'll put this back. Okay. So now, Andrew, I want you, let me take off my gloves. I'm gonna note, touch your throat right here. Can you swallow for me? All right, perfect. No delay in swallowing, no difficulty in swallowing. Okay, can you stick out your tongue for me? Ah, face still appears symmetrical. And can you say ah? Good. And no facial twitching? Noted. All right, perfect. Okay, so good. Now we're going to go down to your shoulders and upper strength. Okay, so right now I'm going to palpate your shoulders. Good, nice muscle tone, no pain is there, no pain or anything. Okay, good. All right, so next we're going to actually, crammers, yes, noted there. All right, so now we're going to assess, I'm gonna assess your lymph nodes. So right now I'm gonna assess your axillary lymph nodes on each side, arms up. We're gonna assess for your axillary, your central, your lateral, and your pectoral, and your subscapular. No pain is there. All right, no nodules felt, no masses. Okay, again on the other side. Good, axillary, central, I know the pectoral, subclavicular, subclavicular, all right, sorry, subscapular. Okay, good, nothing there. All right, Andrew, I want you to raise your shoulders for me. Good, all right, you can put it down. All right, raise them against the resistance. Good, 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 good. All right, kind of feeling, no pain, no, none. Okay. All right, Andrew, now I want you to squeeze my hand for me as hard as you can. Squeeze, squeeze, good, 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 good. All right, next I want you to try to raise your hand with resistance. Good. Pull down. Good. Let me assess your elbows. Good. No pain?
Nope.
Awesome. Over here? No pain?
Nope.
Awesome. Good. I'm going to assess your radial pulses. Good. And bilateral. So we have 2+ bilaterally, non-thready, normal on both sides. All right, now the brachial. All right, perfect. 2+ bilaterally, normal, non-thready. Okay, Andrew. Next, I want you to stand up for me. All right, move your wrist for me. Perfect, awesome. I want you to raise your arms up for me. Assess for your shoulders, no pain in your shoulders. Put it down. I want you to face your hands up. No pain in your shoulders. All right. Okay, next I want you to stick your hands out. Put your thumbs up. Turn to the side and move it. Perfect, no pain.
No.
Shoulders good. All right, perfect. Next, what I want you to do is what I do. I'm gonna look at your back. I want you to put your thumb behind your back and put it as far up as you can. Okay? All right, can you see? Again. All right, good. We want it midline. That's where it's supposed to be. Good. On the other arm. Perfect, midline. All right, no pain in doing that as well?
Nope.
Awesome, beautiful. Okay, you can sit down, Andrew. All right, and with your elbows, do your elbows again. And try to move down, press it down. Good, good. Again. Good, good. All right, and we're gonna assess for your epitrochlear nodules. Sorry, lymph nodes. All right. Good. And both. Good on that side, on both sides. Okay, Andrew, now we're going to assess your anterior and chest wall. So far, your chest appears to be symmetrical, no barrel chest. I'm going to come right here. I'm going to put my hand around here and take a big deep breath. and then out. Good. No barotrace noted. Wall is symmetrical with breath movement. AP diameter is 5 to 7. Good. All right, Andrew, right now I'm going to assess your carotid arteries. Good. All right, both are 2+, bilaterally, non-threading. Now I'm going to listen to the carotid arteries onto the bell side, and we're going to listen for any bruits. Good, no bruits noted. Okay, now Andrew, I'm going to listen to your lung sounds in the front of your chest. Okay. Every time you feel the bell, I want you to take a big deep breath. And out. And out. Out. Good. Lung sounds are heard and clear bilaterally. Now we're going to listen to your heart sounds. Now we're going to go in the right intercostal space to the aortic valve. You can breathe normal, Andrew. Onto the second intercostal space, the pulmonic. Down to the fourth intercostal space, the tricuspid. And sorry, in the pulmonic, S2 is heard greater in that area. Down to the pulmonic 4, and then down to the 5th to the midclavicular line, which is the mitral, which is also PMI. All right. Heart rate is about 74. Okay. S1 and S2 heard. No S3 or S4, and no murmurs noted as well. Actually, for a murmur, I'm gonna have you sit forward with the bell side. I want you on the fifth intercostal space, the midclavicular line. I want you to hold your breath for me. Hold your breath. Take a deep hold your breath. All right, let it go. No murmurs were heard. All right, good. Beautiful, Andrew. Now we're going to assess for your cervical lymph nodes. All right, now we're going to start with your preauricular, down to your postauricular, down to your occipital, down to your submandibular, down to your submental, down to your tonsillar, down to your supracervical, down to your postcervical, and down to your superficial cervical. All right, good. No pain there? All right, awesome. Beautiful. Okay, Andrew. Also, I wanted to note too, in your upper extremities, your clavicles and shoulders are all symmetrical as well. So that's good. You do work out, huh? All right, so next we're going to do your posterior. So I'm going to go behind you, Andrew. You can stand up again for me. Thank you. Thank you for being so compliant. We're going to listen to the lung sounds. All right, every time the bell touches your back, I want you to take a big deep breath. Good. All right, next what we're going to do is I'm going to palpate your back. This is called tactile fermentus, and I want to hear the vibrations in your back. Give yourself a big hug. Every time you feel me touching your back, I want you to say the words 99.
99, 99, 99, 99, 99.
Good.
99.
All right, the vibrations were felt throughout your back. That means your the tactile fermentus was positive. Good job, Andrew. Now what we're gonna do, we're gonna percuss. I'm gonna percuss on your back. Well, you can stand your weight. I'm gonna percuss. Basically, it's this sound right here. I'm gonna do this in all six sides. All right, no fluid was felt, no air, no solid material was noted. Good, perfect. Normal lung sounds. No diminished sounds was heard or adventition sounds. Okay, Andrew, now you can sit down for me. We did the back. Okay, now actually I'm gonna have you lay down for me. Thank you, on your back. We're going to assess the abdominal portion of this exam. Okay, I'm gonna lift up your belly. Good, Andrew's belly appears to be flat. No redness, marks or bruises noted, and no abdominal pulses that I could see right now. Okay, first thing I'm gonna do, Andrew, I'm going to oscillate your abdominal sound, starting with the right lower quad first, going counterclockwise. Clockwise, I apologize. All right. Tickles?
A little bit.
Sorry. All right. Vowel sounds were heard in all four quads. Now I'm going to oscillate the arteries in your stomach. And first thing I'm going to do is the abdominal aortic artery with the bell side. Good. Then the renal arteries. Then the iliac arteries. And then you have the femoral arteries right in here. All right, no bruit sounds was heard. 2+ on all of the arteries, so good. Okay, Andrew, next what we're gonna do is we're going to actually percuss all the quads. Basically, I'm going to feel for any liver enlargement or spleen enlargement, okay? All right, so first I'm gonna start with the right lower quad again, and we're gonna feel the tap. Good. Tiffany sounds was heard. No enlarged liver or enlarged spleen noted. Okay, Andrew, now what I'm going to do is I'm going to palpate lightly on all the quads, and you let me know if you feel any pain, okay? Starting with the right lower quad. Pain? Pain? No? No? What about the upper gastric? No? No? Okay, now I'm going to do a deep palpation this time, and you let me know if you feel any pain. And we're also going to assess for rebound tenderness. Basically what I do is I palpate really deep on the right lower quad and I let go. Any pain? No? All right, negative rebound tenderness, okay? Deep palpation, deep palpation, deep palpation, deep palpation, deep palpation. All right, good, beautiful. And thank you, Andrew, for that completes the abdominal portion of the assessment. Oh, actually, no, I'm sorry. We're going to assess for your appendix, actually. So it's called something called the arbitrator assessment and the Posterior assessment. I apologize if I'm saying it wrong. I know it's PSOAS. So what we're going to do is this assess for appendicitis. So we're going to do the arbitrator test first. So I'm going to take this leg and Andrew, I'm going to lift it. Bend it like this. Okay. And then what I'm going to do is I'm going to turn it to the side, and you let me know if you feel any pain. No pain noted? Okay, good. Now that was be negative, no appendicitis. Now the other one, I want you to turn to your left side. You can turn to your left side. This is the Posterior one. I'm gonna bend this. I'm gonna move it to the back. Pain? All right, good. It was negative. Negative for that. Okay, Andrew, you can go back on your back. Okay, this portion of the exam, we're going to assess your lower extremities, okay? Right now, I'm going to palpate your hips. Okay, pain there?
No.
No pain, no swelling, no tenderness there. Okay, hips seem symmetrical. All right, we're gonna assess for some extension and flexion in those hips. So what I'm gonna do is I want you to lift this leg up. Okay, and I want you to take that leg, this leg right here, and sweep it underneath. Good. Again, this leg, sweep it on the other side. Okay, now I want you to take this leg and I want you to put it out as far as you can. Good, no pain?
No pain.
Good. Another one? No pain. All right, awesome. And next we're gonna test for your knees. I want you to bend your heel to your butt. If you could, this one. Good. No pain noted?
No.
Okay. And the other one? Pain? No? All right, again, Andrew's legs looked intact, nice and muscular. I don't see any redness noted. I don't see any drainage. I don't see any marks. I don't see any lesions or anything in that nature. Okay, Andrew, now you can sit up for me. You can sit, yep. We're gonna test the knees again. I want you to lift up and down. Good. Lift up and down. All right, now I want you to try to lift your legs up for me against resistance. Push it up. Good. Now I want you to put your legs up. Now I want you to push down. Good job. All right, now with your foot, I want you to push down. Good. Push up. Good, nice. Your toes look good. Capillary refill less than 2. skin is intact and appropriate, and the skin color is appropriate for ethnicity. All right, so good. Now we're gonna assess your pulses. You have your femoral pulses right there that we, for the purpose of save time in this video, that we did touch them and assess them, and they're 2+ bilaterally non-threaded, and then non-threaded. Now we're gonna assess the popliteal arteries. Good, popliteal can be felt, bilateral, 2+. Your pedal pulses can be felt, 2+, bilaterally, non-threading. Then you have your tibial pulses, that's behind your Achilles. It can be felt bilaterally and 2+. Okay, perfect. Actually, let me see your hands, Andrew. Actually, forget to note that your capillary refills are good, less than 2 in each hand as well, and in your fingers, and appropriate, no clubbing or cyanotic noted. Okay, noted as well. All right, Andrew, next we're gonna test the sensation in your legs, the same thing that we did on your face, I'm gonna do to your legs. All right, you let me know if you feel any sharpness or dull sensation. Okay. Well, close your eyes. Dull or sharp?
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
All right, Andrew was able to feel sensations in both legs and was able to distinguish between sharp and dull. Thank you for that as well. All right, we did the legs, you did the feet, the hips. Okay, Andrew, next we're going to assess your, oh yes, we're going to do the neurological test. The final portion of the test, we're going to be doing that. Okay, Andrew, next we're gonna test your deep tendon reflexes. Okay, let me get my instrument over here. All right. And actually, no, we'll do this and then there's something else that I forgot to do, but we'll do this first since I have it in my hand. Okay, Andrew, I'm gonna sit down right here. I want you to relax your arm, and we're going to test your reflex of the triceps, okay? Good. All right, now onto your biceps, right here. Good, into your brachialis. Actually, good, all right. Next one. All right, same thing onto your trap. And this one. Okay, your brachial. Biceps. Your brachialis. All right, good. Okay, oops, sorry. Then did we assess your radial pulses? We did assess your radial pulses and your brachial pulses? Okay, and then we did that. Okay, now we're going to onto your legs, to your knees. Good, and here. Good, again. All right, now to your Achilles. Can you flex your Achilles up? No, up. Flex them out. Good, supposed to go down again. Flex them up. Good, down again. All right, Andrew, now we're gonna test for the sensation. Actually, no, your coordination right now. I want you to, we're gonna test the coordination in your hands. I want you to put your hands out, and on your upper extremities, I want you to do this. Good, Andrew was able to do that with no problems, to do fingers to thumbs. Okay, now we're gonna test for the coordination in your feet. I want you to tap your right foot, tap your left foot, not tap fast. All right, good, all right, perfect. Okay, stand up. Now, Andrew, we're gonna test your gait. I want you to walk all the way to that line. Good, note it's up right there. Gait was steady, no deviation noted. Now I want you to walk back heel to toe. Okay, good, perfect. You may, all right, you may sit down. Okay, now I want you to close your eyes for me. I want you to put out your right hand, and I want you to tell me, I'm gonna put an object in your hand. I want you to tell me what it is.
It's a key.
Okay.
It's a pen.
Perfect, now in the other hand.
A quarter.
Good. This one.
It feels like a paperclip.
All right, perfect. Good. Next, Andrew, I want you to stand up for me. We're gonna assess any pronatal drift. I want you to put your hands to the side. I want you to close your eyes. Good. No dizziness or anything felt?
No.
Okay. No drift. No drift as well. All right. Now I want you to the Romberg. So this would be the Romberg test. Romberg test is negative, and I want you to put your hands out, arms up, close your eyes. Good. No drift. Notice as well. Okay. I want you to sit down for me. We're gonna do something called the Babinski test. Put your feet up. I'm gonna put this from heel to toe. All right, good. You thought that. That's the reaction I wanted. Heel to toe.
Yeah.
Good, that's the reaction I wanted. And one more thing, Andrew, if you can lay down for me one more time. I'm gonna assess basically your pubic area. No straining when you pee?
No.
All right, right now I'm gonna palpate your pelvis area. No pain?
No.
I'm gonna percuss. Good, no pain. All right, no tenderness, no nodules or mass hurt, if you can sit. And I'm going to percuss the kidneys for any CVA tenderness. All right, you tell me if you feel any pain?
No.
All right.
No.
Good. All right, Andrew, thank you so much. This completes our head to toe assessment. I'm going to clean my hands and you have a wonderful day, okay?
Awesome.
Thank you.
Thank you.